Dr. Moghanaki, can you speak to your research around strategic initiatives for veterans facing lung cancer? And what should your patients, their care partners, be asking as they seek care?
I really care about driving down the symptoms and the burden of lung cancer. And there's a lot of great treatments out there that are safer and more effective than ever before. Our patients are living better lives and longer lives. And I really focus a lot on that type of research. But one of the things that really probably has the biggest benefit is just earlier detection. And early detection takes place by having an annual chest CT scan with a certain type of CT scan that's a lower dose of radiation that the scan requires. And we don't scan people who have symptoms. So I'm talking about people who are at risk. And right now, our best measure of who's at risk for getting lung cancer are people who smoked a lot of cigarettes in their lifetime and they basically once a year get a scan, and we're looking for lung cancers at the earliest time that they're sprouting. And that's because if we catch it early, we've got the safest treatments and the most effective treatments and the highest cure rates. And so my activation tip is, if you know anybody or if you yourself are at risk for lung cancer because there's a lot of smoking going on, please get your lung screened and talk to your primary care provider to get that lung screening scan ordered.
Okay, and just a follow-up question for that is if a person does have some type of symptoms, or if I guess if they're a smoker also, but if they have some type of symptoms and they say, "Oh, I'd like to have this low-dose chest CT scan," can they just ask their primary care provider about that, or are PCPs automatically going to screen people who have symptoms or have been long time smokers?
It's really a standard of care to get some imaging of the chest. If you've got somebody with a cough that won't go away or some sort of pain inside the chest, in that situation, we don't get a low-dose chest CT. We get a regular CT to take a look. Now, one of the things is if a patient has smoked a lot, people really start to worry, this might be lung cancer. But one of the things that we're seeing is there's a lot of people getting lung cancer who never smoked, or they just smoked a little bit. And the doctor may say, oh, well, I don't think you're going to get lung cancer. And they don't get a scan. And that's actually a problem. So for those patients, my activation tip is, look, if you've got a cough that won't go away, push hard to say, look, I really just want to take a look inside my chest. It won't be a low-dose screening chest CT. It'll be a regular chest CT. And that CT, even if normal, can be a nice baseline for future scans in the future if more scans are needed. It's always good to have a baseline at an earlier age so we can see if new things show up, if they've been there for a while or if they really are new.